Hi, everyone, and welcome to our presentation concerning exercise in the endocannabinoid system. My name is Austin, and also presenting is Danielle, Sydney, Kyle, and Cameron. So let's get started.
Okay, so what is the endocannabinoid system? The endocannabinoid system is a cell signaling system. It uses chemical signals and cellular receptors to communicate. This system was discovered in the 1990s from researchers that were actually looking into THC, which is a type of cannabinoid. Endocannabinoids are lipids, and that means that they are able to cross the blood-brain barrier. This system is involved with both homeostatic and physiologic functions, and it deals with pain control and inflammation.
So what is THC and CBD? Tetrahydrocannabinol, also known as THC, binds with receptors mostly in the brain that control pain, mood, and other feelings. THC can also make you feel euphoric and alter your mental status, giving you the high feeling, as well as it is known to be a bronchodilator.
CBD is another naturally produced cannabinoid in the cannabis plant, but its chemical structure is different than THC's. They both have 21 carbon atoms, 30 hydrogen atoms, and 2 oxygen atoms, but they are arranged differently, which gives them different chemical properties. Because of this, CBD isn't as psychoactive as THC, which is why it doesn't produce a high feeling. And it is nearly impossible to extract just CBD from the cannabis plant itself. Other cannabinoids, mainly THC, will be in the mixture. And there is currently one FDA-approved CBD prescription called Epidiolex, and it is used to treat some types of epilepsy.
So looking at the performance that CBD and THC can have on performance, some of the studies that we have researched stated that 600 milligrams of CBD has no effect on reaction time or accuracy, and there are no reported differences in aerobic fitness, blood pressure, strength and endurance, work capacity, and perceived exertion between users and non-users. And then at maximal exercise, there was also no difference in heart rate, VE, VO2, or volume exhaled. CBD and THC are known for the analgesic properties, not the performance-enhancing effects, so this is kind of what we expected to see with the lack of information on the effects that it has on performance.
So how THC and CBD affect our sleep and recovery habits is when the CBD exhibits moderate efficacy as a treatment for chronic pain, which is quite interesting, and also has been proven to be an anti-inflammatory, neuroprotective, and pain-relieving effect for anybody that is dealing with those issues. And also CBD has been reported to attenuate immune cell accumulation and as well can help with inflammation. Furthermore, many athletes report suboptimal sleep quality, which is quite intriguing. And according to research, 160 milligrams of CBD increases sleep duration and quality.
Psychological effects. So THC on its own can cause some psychological effects due to its euphoric effects, but CBD does not display these effects. When they are used together, which is common, high levels of anxiolytic effects have been shown when users are in a high-stress environment. It's unlikely that THC and CBD have an effect on cognitive and psychomotor function. However, any effects that it does have are affected by the dose, route of admission, and experience of the user. It's also been shown that CBD levels of up to 51 milligrams per day can help relieve symptoms that are linked to a concussion. These can be things such as anxiety, aggressive behaviors, as well as depressive symptoms.
Referring to current dosage guidelines, the World Anti-Doping Agency has a urinary threshold of 150 nanograms per milliliter for only THC, and CBD is no longer prohibited. Next, the NFL has banned THC at 35 nanograms per milliliter and CBD is banned. The NBA has banned both substances. The NCAA does not directly indicate that these substances are banned, but is by association due to chemical relations. Next, the MLB has light restrictions and focuses more on the drug policy for performance-enhancing drugs, not cannabis. Then finally, the NHL does not have banned substance restrictions.
With this information about how THC and CBD affect the human body physiologically and psychologically, we can begin to suggest certain dosages based on the research. Several studies on THC and CBD suggest that a moderate dose of THC is 18 milligrams, and systolic blood pressure can increase after 10 milligrams of THC. Doses of up to 18.2 milligrams of THC have no effect on performance variables. Next, doses of up to 600 milligrams of CBD have no effect on reaction time and accuracy. 160 milligrams of CBD can improve duration and sleep quality. And lastly, doses of 100 to 1200 milligrams of CBD has been shown to affect resting heart rate, but it also decreases resting systolic blood pressure.
So as Sydney kind of alluded to, right now there are numerous different guidelines for all the major sports associations. Every single association has something a little bit different. So looking forward, we'd be looking to establish one universal guideline. We would also like to request funded research to establish more accurate and research-backed recommendations. A lot of the information out there is only in the beginning stages and cannot be adequately extrapolated on. So we would like more research to be done. For the one universal guideline, we'd like to propose a limit of 200 milligrams of CBD and 20 milligrams of THC. If you fail to comply to these guidelines, the first offense will be a warning, the second offense is a fine of 5% of the salary, and the third offense is a suspension for a quarter of the season without pay. These are our references, and thank you for listening to our presentation today.